This is The Effects of Tuberculosis on Signal Transduction Pathways by David Cunningham. Okay. So, slide 1, Symptoms of Tuberculosis. Some of the most common symptoms of tuberculosis are chest pain, a bloody cough, weight loss, and loss of appetite. But the serious, deadly stuff can be prevented pretty easily. Prognosis of tuberculosis when left untreated. Tuberculosis starts out as a bacterial infection in the lungs. Immune cells called macrophages come and attack the infection. Most of the time this works out smoothly, but when it doesn't, it can get bad quick. When the tuberculosis is internalized into the macrophage, this triggers an inflammatory response which brings out other immune cells, and they form a tissue called a granuloma, which is what this picture right here is. It's a granuloma. In the granuloma's early stages, there is a core of infected macrophages enclosed by other immune cells. The macrophages full of bacteria are then killed, resulting in the caseous center of the granuloma right here. The bacteria are dormant but still alive. It can stay like this for years. If the immune system is compromised, however, then the bacteria can escape and replicate. After the tuberculosis escapes, they begin to infect other areas of the body through the lymphatic system or the bloodstream. Bone, kidneys, intestines, and the brain are all susceptible to the bacterial infection. When it reaches the brain, it can cause migraines and impaired consciousness. When it infects the skeleton, it can cause aches and pains all over the body. And when it gets to the kidneys and intestines, it can cause severe abdominal pain. How one contracts tuberculosis. So tuberculosis spreads through the air in a similar way to coronavirus. When an infected person coughs, microscopic bubbles of saliva containing tuberculosis stay suspended in the air. When someone breathes them in, they can get infected with as little as 10 bacteria, which is a really crazily small amount. Is it a ligand or a receptor or both that are affected by the tuberculosis? The tuberculosis affects the receptor and not the ligand. It inhibits human T-cell receptors by blocking the ZAP70 phosphorylation, which plays a critical role in T-cell signaling. ZAP70 is directly involved in polyclonal CD4+ T-cell activation, which is basically how all the different immune cells talk to each other. So yeah. How is the signal transduction pathway affected by the tuberculosis? The underlying symptom of what I talked about in the last slide is due to the deactivation of the calcium 2+ signaling that produces the maturation process. LAN, or this really long word that I can't pronounce, is released from the tuberculosis, and this is what turns off the CA2+ signaling. How does a normal response get altered by the tuberculosis? So normally, the MHC, or major histocompatibility complex, binds to the peptides in an intercellular location and delivers it to the cell surface where the ligand can be recognized by the T cell, and the ZAP70 phosphorylation process will begin. When the tuberculosis gets involved, it produces LAN, which was what was in the last slide, and targets the T cell receptors and stops the CA2+ signaling, which in turn stops the ZAP70 phosphorylation. Treatments for tuberculosis. Treatments are done through antibiotics. Treating tuberculosis can take up to 6 to 9 months and possibly over a year, however. Common drugs used are isoniazid, rifampin, ethambutol, or pyrazidamide. It should be noted, however, that if you have an antibiotic strain of tuberculosis, this can cause serious problems, and you will need specialized drugs for that are not usually found at drugstores. So yeah, that was my presentation. Hope you guys liked it.